This is our Ultra G or anti-gravity treadmill. It eliminates a significant amount of your weight to decrease the strain that it places on your joints when you're walking or running. So it's really helpful to normalize a person's gait pattern.
I utilize the Ultra G with a huge variety of patients. We could reduce somebody's weight from 1 to 80%, and it really helps you basically remember how to walk again, so there's a lot of carryover when you're just walking around.
So let's have Courtney put our shorts on and show you how it works. So now we have Courtney in the cockpit, and we're going to inflate the machine, and she's very safe. So we're going to start the machine, and it's going to calibrate her weight so that when we tell it how much weight we want to take off, we can do that. So it takes a minute to do that. And if you look at her feet, it's going to lift her right off. And it's going to do that 2 times. And it does not tell us how much she weighs. And then once we have it calibrated, it functions just like a normal treadmill. And then it's going to deflate, and we'll start from scratch. Okay. So now let's say that she had an ankle fracture. So we're going to start off kind of conservatively and take off about 50% of her weight. We want a weight which has no pain when she's walking. So we're going to take off the weight, and it's going to blow up till it matches that. And then I'm going to have Courtney turn the treadmill on nice and slowly. And again, we can watch her gait pattern through the bubble or on the screen up above. And we want to watch as normal of a gait pattern as we can. And if we turn it up too high as far as the speed, we can turn it down if she has pain. Or we can say, oh, Courtney has a little pain in her ankle now, let's take a little bit more weight off until she doesn't have any pain, and then she can walk. Whereas normally you may not be able to walk more than 10 feet. And then there's 3 cameras. There's a camera from the front, a camera from the back, and a camera from the side. So she can have biofeedback seeing what her feet are doing at the same time. And she can flip through those screens, and we can give her cues from what we see on there as far as, oh, you make one stride longer than the other, make some corrections. So we do this however long that we choose to do during her plan. And she feels good about actually being able to walk, whereas she couldn't before. Of course, we have higher level athletes on here too as far as running for gait analysis and such. That's very much fun, and patients usually really like it. See, she's smiling. Okay, so then we're going to be done. So I have her bring the treadmill all the way down. And the treadmill can also incline. She can walk backward or whatever we feel like is part of her plan. So it's down to, then we're going to slowly increase to all her weight again, so we don't all of a sudden go to full weight and then she will have pain. So we're going to increase the weight. It's going to slowly deflate. And then we stop. And that's the end of that anti-gravity treadmill exercise.